VOA, and Lori and Sarah, you have the same accessibility, so this will be the same for both of you. Your main screen, I don't add any customized dashboards or anything. If you want them, I can put them on for you, but I don't use any of those for agencies. When you are working down through the left-hand side, these are all the buttons you'll ever need. You'll really spend all your time in Client Point. Client Point is where we search for clients, enter services, enter programs, all of that. Resource Point, we don't use in York County. Resource Point is like a cheat sheet of agencies that are in the system, but because York County is such a small county, we just don't use it. Usually the different providers know each other and know how to reach out to each other. It's used a lot more heavily in statewide HMIS. The reports button is where you'll find your SSVF reports. The admin button offers you some customization of your agency, but I usually do all the customizations because I have more access than you guys do. And log out gets you out of the system. Pretty simple. So you'll go to Client Point, and the first thing you get is a search screen. You must search before you can enter anybody. I think that's pretty standard in this day and age in HMIS. Reason being to prevent duplication. This system offers a lot of fields that you can search by, but I tell everyone I recommend searching by only first and last name. The more things you fill in here, the more narrow your search boundaries, and I don't want to run the risk of missing a client that we could build on. So you'll type in a first and last name, you hit the search button, your client results show up at the bottom. I don't have a client by this name. That's on purpose because I want to walk you guys through a brand new client. Once you've searched for a name, you'll get the opportunity to add a new client with this information. If we had searched for someone that does exist, their record will come up at the bottom. It'll give you their name, social, if it's available, date of birth, gender, a little bit of information. If they're available, you'll click on their name. It'll pull up their client profile, and you will verify the information is correct on the client profile. If it is not, you have the authority to make changes there as long as you can confirm your information is correct, and then you will work through your tabs. It's a lot easier when someone is already in because you don't have to do quite as much data entry from the start, but I want to show you a clean client. So we're going to do Bill Veteran Test. Okay, he doesn't exist. We're going to add a new client with this information. It'll always ask you, are you sure you want to add a new client? You can just click OK. And it will automatically create a new client record for Bill. His client number in HMIS is always automatically assigned. So until I created him, we had 8,804 clients, unduplicated clients in our system. He's number 5. And it'll only enter information I searched for. So the only thing that's filled in, of course, is his client name. So what I tell everyone to do is, you'll see there is a summary tab here. The summary tab is just a quick snapshot of the client and what they've done, what their history looks like. What I tell everyone to do is really to work across the tabs for client profile, household, ROI, which is your release of information, entry exit, and then potentially case managers might be helpful for SSVF. Case plans and assessments are not required by me. They are not required by SSVF for you to enter them. So those are completely optional, and you don't have to do anything with those. SSVF does require service transactions. So after you've worked through the client profile list of tabs, then we'll go to the service transactions and enter services. So client profile is first. This is your basic information, and there are 2 sections you need to fill in. You need to fill in information for client records, and you need to fill in information for client demographics. There are other things at the bottom of the client profile. There's a place for notes, there's a place for file attachments, and there's a place for incidents, and I do not require any of those. So on the client profile, all you have to do is client record and client demographics. Pencils within Service Point will get you a screen you can edit. So anytime you see a pencil, click on the pencil, and you'll usually get a pop-up screen that you can enter information. If you accidentally had your caps lock on or didn't have it on or whatever, and it's driving you crazy when you did your search, you can make changes to the name of the client here. So once you have your name in, you'll want to do your name data quality. For housing programs, it's always full name reported. The only reason these options are here is for outreach programs where you might not know a person's name. There's a place for alias. It is not required. If the person has one, you're welcome to enter that. Social Security is probably very similar to HMIS. You can enter the full social. You can enter any part of the social that you might have on hand, and then you'll reflect that in the Social Security number data quality. So if I only have the last 4, that's completely fine, and I can say that I had an approximate or partial Social Security number. U.S. military veteran is a simple yes/no question. You guys will always be checking yes, so we'll make Bill a veteran, and you click save. Fills in his information. Age will fill in after we provide a date of birth. You'll click on the pencil beside client demographics. You will again get a little pop-up box, and you can fill in this information. I think you guys will always have a date of birth, but once in a while I have someone who knows the person's age but doesn't know the month and day that they were born. And when that happens, I recommend using January 1st of whatever the appropriate year is for that person's age. Date of birth type will ask you if you've reported their full date of birth, whether or not it's an estimate like I just suggested using January 1st. Gender right now is this list. It should also be the same. These are all HUD fields, so they should all be similar. This field is changing, and I will show you what it's going to look like after we're done with this working through a client. So you can choose the appropriate gender here. We asked for 2 races in our system, or up to 2 races might be a better way of saying it. I highly recommend at least a primary race. If someone only identifies with one race, you can just fill in the primary race. Secondary is not required. If they have more than 2 races they identify with, just give me the first 2 that they've provided you with. If you have someone who, and this happens a lot with Hispanic and Latino folks, doesn't identify with any of the categories that you'll find under the race drop down, what I've been recommending to people in lieu of any kind of real advice from HUD is responding that the client doesn't know, because we find a lot of folks want to just say they're Hispanic or Latino and not identify with any of these categories. So
and Lori, correct me if I'm wrong, but this is one of the options that we refrain from using in Pennsylvania HMIS, because when we upload to the repository, this was an answer that would get us kind of dinged. Is that right, Lori?
Yeah. So
it does show up as a missing data field. I mean, it does show up as a missing data field.
Identify, then I'm just going to pick something for them.
That's fine.
Yeah, we usually really try to make sure that we get that question answered as best we can. So
sounds good. All right, and then ethnicity, of course, is your non-Hispanic, non-Latino, or your Hispanic Latino.
Yep.
And then you press save, and it will fill in. It does fill in the age then, and that's it for client profile. So that's all you have to do here. If you, like I said, if this person already exists, I just ask that you go down through and verify the information. It does happen sometimes. People transpose numbers, and if you find that, I just recommend confirming with the client that what you have is correct, and then I'm completely comfortable with you making the change here. Information on the client record is shared across all the programs no matter what. So when you make a change here, everybody will see only that change. They won't see what they entered. So I like to have this information be the most up-to-date and the most accurate. After that, you'll work across to the household tab. Households, of course, must be created for any group of people that you're housing, and it doesn't really matter what their dynamic is, just that they are living together. If you have a single individual, then they do not have to have a household created at all. They are automatically recognized as a single individual. You do not have to search existing households. If the client already exists in the system, you'll probably already see a household here. You can always build or remove from an existing household. You don't have to create a brand new one, even if the people in the household have changed. When you get to that point, when you encounter that situation, I'd recommend just reaching out to make sure you're doing it correctly. It's not something I like to cover in initial training because it's a little confusing and it's something that people tend to not remember unless they're actually doing it. So when you're creating a new client, they have no household, or an existing client doesn't happen to have a household in the system, but they have a household now that they're being served by you, you'll start a new household and you get a household type question and then that exact same search that we had under the client point search screen. Household type is very broad generic categories for the type of household that it is. For simplicity's sake, I'm just going to make this a male single parent. And then it'll ask you to search for the person's family members. It always populates with the main head of household last name, but you can change this. People have different last names. It's fine. So search for the name of the person. And at the bottom of the screen, you'll see you get your client results. And also below that, you'll see selected clients. Selected clients will show you the list of people who are in your family currently. So if someone is not in the system, you'll need to add a new client with this information. Yes, I'm sure I want to. And then it includes Jeremy, who is Bill's son, as part of the family. If you search for someone that exists, they will come up under the client results. You can use the green circle with the plus sign to add them to the family. If you would accidentally add someone who's not correct, you can always use the red circle with the minus sign to remove them. Depending on how big the family is, you might sit here and search for a lot of people. You want to make sure you search for everybody that you're aware is in the family based on your documentation and add them on this screen. You can add people later. It's just easier to do it here. Once you've added everyone to the family that you need to, you can press continue. And it will take you to the next screen. The only thing you really need to do within this household members tab, which is really the only place you're going to fill anything in, you don't have to do anything up here, is the head of household, which is Bill, which automatically makes him the self head of household. Jeremy is not the head of household, but Jeremy is his son. So you'll choose the appropriate relationship from the drop down. And that's all you'll need to do for everyone in the family. The joint household date will always automatically populate with today's date. The biggest change probably between, or the biggest difference between George's system and my system is that we elected early on to not use the backdate process. I think George still uses it and he continues to have a little bit of trouble with it. Backdate allowed you to tell the system, the whole system, that it was a different day than it is actually right now. So I could tell the system it was September 1st instead of September 27th. And that supposedly allowed you to have more accurate reporting. But what we found was most people forgot to change the date when they moved from client to client, forgot to put it on at all in the first place, couldn't remember where they were at in the backdate process, and that actually created a much larger data entry and data quality headache than any accuracy we saw when people did it correctly. So we don't do that. As a result, in most places, you're going to see either today's date or the date that you've manually entered as their entry date into your program. So for households, it always populates with today's date. I don't care when they became a household, but your joint household date makes sense to match your entry date. That's all I ask. All right, so at the bottom of that screen, there's a little bit of information. You'll see that the client record is duplicated here for Bill. We've already filled that in. But if I click on Jeremy and I highlight him in blue, you see he doesn't have any information, and that's because on the last screen, I created him. He didn't exist until then. If he did exist, you would see his information here. You can click, you have an option here. You can click the client record pencil here, and you can fill this information in, or you can do it later by going into Jeremy's profile. I typically recommend people do it here just because it's easy to forget to go back into Jeremy's profile. There's really never any need to within this system. So pencil will give you his record. He has a full name reported. He has a full social. And he's not a veteran because he is a child. The U.S. military veteran question is not required to be answered by children. However, I find that for data quality purposes and the fact that it takes a millisecond to do, it's just easier to say no. Save. It'll save his information. If there was a whole list of people in this family, you would just do the same thing for everybody in the family. You'd work your way down through all the names. Whoever's highlighted is who you're working on. Save and exit. And it says, wait, do you want to review the head of household and the relationship? And are you sure all of this is right? And your knee-jerk reaction is usually to say yes. But if you say yes on this screen, it just takes you back to where you were. So you actually want to say, no, I don't want to review any of this data now. It'll create a household. The household does have a number, but we tend to not use it for much. I use it on the back end, but most agencies don't use it. It also shows you the people in the family, the head of household, the join date, and the relationship. Then you move on to the ROI tab. ROI is very simple. It's just giving me, oh, go ahead, something? Okay. So add release of information just gives me, as the system administrator, a double check. This allows me to make sure that people who have not wanted to share their information are in fact locked down. Traditionally, I have no trouble with this. It's just a sort of an extra check for me because I don't get a copy of the HMIS release, and honestly, I don't want it. This allows me to know whether or not that person has denied sharing their information. Anytime in the system you have a family, you will see on the release of information, on the entry-exit information for the program, and on the services information, you'll see the family listed at the top of the screen. This allows you to work, of course, through everyone in the family if need be, without switching between all of the individual members. So for release of information, I can click the checkbox beside male single parent, and it'll just choose everybody. This means that once I fill this in, and once I have saved the release of information, both Bill and Jeremy have that release on their record. So if I searched for just Jeremy alone, I would still see that he has a release. Provider, you can leave this as your agency. It will default to your agency because all of your users, which right now is Sarah and Lori, will be under the heading of the agency. I don't assign users to programs because 90% of the time people work under multiple programs. So you're always going to default to an agency setting here at provider. For release of information, that's fine. Release granted is a yes/no question. Yes, for me, means that they have agreed to share their information. No means that they have preferred to have their information locked down and not shared within York County. A start and end date are required, and I tell everyone just do a year. So if it's today's date, then it's just the 27th of 2018. And I've been out of PA-HMIS long enough that I don't know all of their protocols. So a lot of this is probably the same. There are options here for documentation, but the only one we use here is signed statement from client. We don't traditionally do verbal consent, and we don't traditionally do verification from other institutions. Witnesses are not required. Once you're done, you can press the Save Release of Information button, and it saves it to the ROI screen, which allows me to see a quick yes or no for the permission. Next up, of course, is your Entry-Exit tab, and this is where sort of the heavy lifting starts. I will tell you that if a person is already in the system, they've already been served by agencies in York County, you will see a list of projects here, and entry dates and exit dates, and that's fine. The only thing you'll ever want to go in and edit is your VOA heading programs. So you'll add an entry exit for the VOA program. And again, you'll see that it offers you the whole family so that you can work on everyone in the family at the same time. In the off chance that an existing client has a very lengthy family history listed here, and perhaps all of those people aren't actually entering housing in your program with that person, all I tell you to do is just check mark the appropriate people who are joining the household with your program, because that does fluctuate a little bit from person to person. For provider, this one you do need to make a change. You need to change to one of the programs. Now, up until October 1st, we were recording SSVF information under one program. It was just an SSVF program. With the new data standards, it is requiring us to break out homeless prevention and rapid rehousing. So I don't know, I think you guys do homeless prevention in addition to rapid rehousing, don't you?
Correct.
Yeah, okay. So I went ahead this morning, as soon as I got here, created a homeless prevention program for you, because when I had created it previously, I just had the rapid rehousing. But when I read the new guidelines yesterday for the VA programs, I realized I needed two. So you guys will have to split your folks out between homeless prevention and rapid rehousing. Okay. Not really a big deal. Most places do that, I think, nowadays. I will admit, like, I just read the data standards for VA. I finished the HUD version yesterday, so I then launched myself into the next round, which was veterans, which was you guys, and then PATH is next after that. So if I find anything else that needs changed, I'll make the change, but I will also notify you that I've made the change. So you'll know. All right, so just for simplicity's sake, I'm going to put this this person in rapid rehousing. Your type, for 99% of the people on HMIS, it's HUD, but for you guys, of course, it is VA. And then
Kelly, I have a question. I think now when we're entering clients into PA-HMIS as prevention, we also have to enter their threshold score, or I don't know what you guys would consider that. Like if you do an assessment score for them, we have a high risk score for the clients that we put in prevention. That's not something that would be required of us to put into this particular program.
I think what you're talking about is on the assessment, on the next screen. So let's talk about it. Hey, we'll go to the next screen and we'll talk about it.
Okay.
Okay, so you guys will choose VA as your type. Entry date, of course, just like any HMIS, I think, can go back in history as far as it needs to. It cannot go forward. So you can make the change to that date. We do not use the timestamp. So whatever pops up in the timestamp is whatever time it was when I opened this window, and that's fine. You don't have to change it to midnight, or you don't have to do anything with it. Just ignore its existence. In some communities, I guess emergency shelters use it as a first come, first serve thing. Like you came in at 9:30, so you get a bed tonight, but now we're full, and you came in at 9:40, so you don't. Save and continue will get you to what I call the assessment screen. This is where most of the information is filled in. So it will always automatically default to your entry, your SSVF entry, and that's the one you want to fill in, of course, at the beginning. So Bill is highlighted here. That means we are working on him. And then it will ask you for information. I would say the information is the same information as PA-HMIS. They may ask special questions that I do not. So it'll ask, date of birth, the date of birth type, the race, the ethnicity, and the gender.
Did you go back?
Yeah, what's up? Oh, I can't hear you. What's up?
Did you go back and try and put him in prevention? That way we can see if it actually has the assessment that we need.
I can, but they actually have the same assessment. There was no difference in assessment required in the system. They just wanted to split out, I think, who you were preventing and who you were rapidly rehousing. But I can certainly do one for prevention. That's not a problem.
Well, then, Sarah, what are we going to do? Because we need that, I think, I don't know if that information gets uploaded to the repository or not.
Well, I think
Let me show you what I'm talking about. Is it this thing? HP targeting criteria?
Yeah, there we go.
Okay.
So I don't know why, but
It's in a different section.
The Service Point, when they created the assessment for SSVF, chose to leave a single assessment in place for both rapid rehousing and homeless prevention. So that was homeless prevention. Now I'm in rapid rehousing. It's the exact same one. You'll see there's still on there.
Okay.
So it is in here. Is that what you were missing?
Yeah. Okay.
So it's in there. And absolutely speak up with those things, because of course I have you guys and I have YWCA, and that's really it. So I'm not nearly as versed in the VA programs as I am in the HUD programs. All right, so it doesn't really matter, unfortunately. You'll see that the entry is actually called VA SSVF entry for HP, homeless prevention, and RRH, rapid rehousing. So, yeah, it's there. I think what Bill and I discussed when we set them up, they've been on it for a little while now, was that they just don't fill in the HP targeting criteria on someone that they are rapidly rehousing. It wasn't required, I guess, is the best way to say it.
Yeah, well, it wouldn't even make sense for us to do that anyway, so.
Right. Okay, so of course there's a little bit of info from the client profile, and then there are a couple of questions here that are pretty standard, I think. Just a yes or no question about whether the person has a disabling condition, what their relationship is to the head of household, client location. I think client location is going to change on October 1st, but I'm not 100% sure. Client location is just our continuum of care code. It's PA 512. I've asked them if we can just, like when you only have one code, if you can just default it, but they haven't made the change yet because we only have one code. Residence prior to project entry is where they were living when they came to your program, and they are sort of outlined in categories. There's your homeless situation, housing and options. There's your institutional situation, housing options, and then your transitional and permanent housing options, and then, of course, your doesn't know, refused, and data not collected. The only thing I remind people when I'm training is your county does not have safe havens. So,
right.
Just an FYI. All right, so for the most part, people will be coming from homeless situations. You might have a couple from institutional situations, depending on the case. If you choose emergency shelter, it will ask you, of course, the length of stay in the place that they were staying. So I'm going to say a week or more, or less than 1 month. And then it'll ask you questions about their homeless status, trying to get at whether or not the person is chronically homeless. It asks you when the date that their homelessness started, how many times they've been on the street in emergency shelters or safe haven in the last 3 years, and then how many months they have been on the streets, emergency shelter, or safe haven in the last 3 years. If you choose something outside of the homeless situation, those questions change. So if instead of taking someone from one of these options, if you enrolled someone who was coming to you from a hospital, for example, the questions change. It'll ask you, there's an automatic fill-in question about did you stay less than 90 days, because 90 days, of course, is when your homeless status change. So if I had chose 90 days or more, that question says no. If I have anything under 90 days, it says yes. And then it'll ask you on the night before you went into your residence prior to project entry, did you stay on the streets, an emergency shelter, or safe haven, just confirming that they were homeless when they went into that institution. So your answers change a little bit depending on what you choose here. I have no idea how PA-HMIS does this part, so. Full disclosure. Okay, working down through, it'll ask you for total monthly income. You don't have to get fancy here. You can just literally type in the number, dollar signs, and change are optional. Yes, they have income. If a person happens to not have any income, you can say no. For entering income, for entering non-cash benefits, health insurance, and disabilities, there are these HUD verification links. Rather than, don't use the add button. This is an old throwback to the last data standards. You want to use the HUD verification. So click on the HUD verification for monthly income and you will get this pop-up box that shows you all of the income types. The big change on the last data standards for us was it was no longer enough to say, yes, this person has earned income. Now you also had to say, no, this person doesn't have alimony, they don't have child support, they don't have general assistance, et cetera, et cetera. So this screen allows us to do all of that much faster than using that add button. So what I tell everyone is to prevent carpal tunnel, choose no at the top. It will fill in all of your radio buttons for no, and then you can just choose the radio buttons for yes that correspond to the person's income. So I'm going to give him earned income of $1,000. It'll automatically populate the entry date here. You can change it if you want to, but I don't require the date his income first started, for example. Press save, and you'll see that the radio buttons for that one get shaded out. And the way you would edit it, if you would need to go in and edit, would be to click the pencil. It brings your screen back up and you can make changes. And then I'll give him, well, let's give him something veteran related. $500. Save. You can do that for as many as you need to, as many income sources as they have. When you're done, you'll save and exit. And you'll see that your HUD verification goes from a red triangle with an exclamation point to a green square with a check mark. And we like those. Non-cash benefits. Does this person get any non-cash benefits? Yes or no? HUD verification link. It's not a long list. And one of the things that will be changing in October when you guys start up is Section 8 and temporary rental assistance will no longer be on here. So again, I tell everyone say no, and then just choose yes for all the things that you need to choose. So I'm going to say that this person does get food stamps. There is no additional pop-up. It will not require you to put the amount of money that person gets for food stamps, for example, just that they're receiving that benefit.
Oh, that's nice. Lori, in PA-HMIS, when they ask that question for non-cash benefits, is this where it's listed that they receive VA medical care, or is that listed under the insurance on PA-HMIS?
That's listed under insurance.
Okay.
It is here too.
Okay.
Now, I'll show you that you have the ability to include the amount of money for a non-cash benefit, but it is not required. It used to be. Once upon a time it was, but in the last two data standard changes, it hasn't been. So exit, and covered by health insurance, yes or no. Say yes, click the HUD verification link. Of course, click your no button at the top, and then choose what you need. And Sarah, here's your Veterans Administration medical services.
Okay, great.
So we'll give him that. There is no additional information required for this either. So I clicked the yes button. I got no other pop-ups. It's just whether or not they have insurance. And they can have multiple insurances. You can choose as many as they have. So he could have 2 if I want him to. There you go. Save and exit. You get your green check mark, you're good. Disabilities. Now, disabilities isn't necessarily required in the manual that I read this morning for SSVF, but I know when we set up Bill's programs, we talked a long time about entering that information, because then I can pull it when we run local reporting on what the disabilities are that we're seeing in our population that's going through the program. So I don't know if you guys enter this in PA-HMIS or not.
I think we do, Lori, right?
Yeah,
okay, good.
They do with it, but it's in there.
All right, so if you click the HUD verification link for disabilities, then of course it gives you the list of HUD identified terms for disabilities. And they are the same thing. I tell everyone to click no. If someone has no disabilities, you still need to come in here and click no for everything. If they have something, of course, click yes, and there is a pop-up screen here. Now, it looks really awful. Everyone hates this screen. But this screen is changing in October. So when you guys start up, of course, next week, you don't have to answer all of these. You have to answer this question about this one that says, if yes, that they have a disability. It's expected to be of long continued and indefinite duration and substantially impair their ability to live independently. You do not have to do anything with documentation about whether or not you have, ownership of documentation about the severity of this disability. You don't have to do anything for this mental health problem, alcohol abuse question. You don't have to do anything for the mental health, serious mental illness question. You don't have to do anything about currently receiving services or treatment, but you will need to answer if the above condition is going to be long-term. I'll show you how the screen changes when we're done with this. So the only thing you have to choose here is whether or not they can live independently or not because of their disability, and whether you feel that the condition is long-term. Most conditions are long-term. That's just the nature of the disability. Press save. You can do as many as you need to here, and then save and exit. Residential move-in date is changing. This is something we'll talk about at the end. Short answer, of course, is that this will be renamed the housing move-in date, and it will reflect the day the person actually moved into their unit. You may have to come back later and fill that in. That's okay. You can do that. Last grade completed is required for SSVF. We haven't asked it for HUD programs in many years, but you guys still do. So this gives you all your options, and you can choose the appropriate one. There is a place for veteran information. You'll click the add button on this one, and it will give you a pop-up box, which I imagine looks relatively standard. The year they entered the military, the year they separated from military service isn't required, but there's a place for it. And then it lists several periods, I guess you could call them. I'm sure there's a better term than that within the veterans realm. And it's just yes, no, whether or not they served. There is a place for their branch of, oh wait, here. Yeah, there's a place for their branch of military. And there's a place for their discharge status. So doing my math, 37, let's do this one. In the Army, honorable discharge. You can add multiple ones. If this person has multiple periods of service, you can save and add another. And what it'll do is it will save that record, it'll bring the screen up blank, and it'll let you enter another one. When you're done entering them, you can press save, and the screen will back out, and it just records the information here. There's a question about percentage of AMI, less than 30, 30 to 50, greater than 50. There is a place for the client's address. The address screen in Service Point is really robust. What I tell everyone that uses it, which is few programs because most programs don't provide housing address for homeless individuals, is there's a place for the street address, there's a place for the city, the state, the zip. You don't have to fill in like the landlord information, for example. That doesn't go anywhere. It's just for your use. And then you can save. It'll record the address for the person. This is one that I actually have to ask about. So your VAMC station number.
595.
Well, right now it's a type box, right? So it's 595. I type it in on my keypad. But October 1st, it becomes a drop down.
Oh.
But here's the thing. And I literally discovered it this morning, so I have not put the question in yet to Service Point. When I look at the new assessment in my training site, they have not included a place for VAMC station number in the SSVS assessment. So I don't know if someone missed it and no one has talked about it yet, but I'm going to alert them and see what they want to do to fix it.
Yeah, absolutely.
So when you guys see it next week, it should be a drop down. I think they were having a lot of trouble with people accidentally typing the wrong thing in here.
Okay.
So right now it's a type, but next week it'll show VAMC station number and then it'll say retired because they're not using it anymore. But I'll make sure they have something there for you.
Okay.
All right, and then of course, if you're doing homeless prevention, there are these targeting criteria. My assumption is these targeting criteria are set by the VA and these are pretty standard.
Right.
Okay, so these, you know these questions, I don't really need to go through them, right?
Nope. No, they're on our assessment.
Okay, and I would say the answers are probably pretty standard, yeah. Pretty standard too. Okay. So if you're doing homeless prevention, those questions are there and you can complete them. If you're not doing homeless assessment, so if you're doing rapid rehousing, after you enter the VAMC station number, that's it for the assessment.
Okay.
So if you scroll back to the top, you'll always see the whole family here. The kids or the spouses or whatever are always going to show up here. And I recommend filling in information on them as well. So for Jeremy, I would put in his, let's say his date of birth. I would put in a race for him, an ethnicity, a gender. You might not have information on disabling condition for the children. That's okay. I don't know if you collect that or not. You will want to say that he is the relationship with the head of household, the client location, and then where he was staying, whether or not, you know, he was with his dad or if he was somewhere else. He might have been living in a family member's room since his dad was in the emergency shelter, how long he was living there, and that's it. So I just asked for like the basic information about kids. If you get another adult, I recommend completing the information down to where this last grade completed and veteran information starts, if they're not a veteran. Of course, if they're a veteran, fill in all the information that you need for your reporting. But I just want to make sure we capture like the whole household's income if it's not all coming through a single person, if it's through two people. Once you're done with everyone in the family, you can save and exit. Oh, for goodness sake, I have to complete this one for everybody. Save and exit, and it will take you back to this screen. So if you serve someone for more than a year, do you guys ever serve someone for more than a year?
No.
No, okay. You don't have to do them then, congratulations. People that serve, programs that serve people for more than a year are required to do an annual assessment to show changes in income. But if you guys don't do it, then I don't have to teach it to you. I didn't think you did, but I wanted to make sure.
No, 9 months. 9 months might be the longest, but we don't tend to go over a year.
Okay. So once you've entered someone, you know, stuff happens during the day. So if you get pulled away.
Haley, hold on.
What about our research? We have changes in income then. That's only 3 months, but we still have to put them in the system. So is that where I put it in?
Okay,
right,
so you guys do research.
Well, we do recertifications at the 3-month mark, right? So good point, Lori.
Oh, okay, good. Thank you, Lori, very much. Okay, I'm going to show you then. So this interims column, it's hard to see on your screen, even like me as I'm looking at it directly without GoToWebinar. It actually looks like a piece of paper, but if you click on it beside the appropriate program, you get a little box, and it'll ask you to add an interim review. It will include the whole family. You can choose whoever you need to do an interim review on. If you don't need to do one on everybody, that's fine. And then interim review type gives you options here. So you guys do it every 3 months, so you guys would be like a 90-day review.
Huh, okay.
So
and then if we recertify, then I'm assuming if we recertify them again for another 30 days,
you'll do
or
it
another
again.
90 days, we would say then 120-day review.
Yes.
Okay.
It actually won't matter. You can do a 120-day review, or you could do another 90-day review. My recommendation, I think, would be another 90-day review, so that if we ran a report on it, it would show you were recertified every 90 days.
Okay.
Okay?
Yep.
So 90-day review, and then it'll ask you for the review date. Of course, you will put in the review date. The system will trip you if the date you put in, this is confusing to explain, is not within 30 days of their anniversary. So you'd want to be within 30 days of the 27th of whatever that month was. Do you know what I mean? So
even though we're not
recertify them, even if you're going to recertify them like December 27th, which would be
right,
yeah, it would be 90 days. This date field will ask you to make sure that the date you enter is within either 30 days before or 30 days after December 27th.
Oh, right. Okay.
So regardless of when you did it, you just have to make sure your date is within 30 days of that.
Right. Okay.
So once you do that, you'll save, and it'll bring you into this screen. It will automatically choose the SSVF update, which is what we want, and it'll ask you for, of course, updates to income. It'll ask you for any updates to non-cash benefits, to health insurance, and to disabilities. You may also have a residential move-in date update, but I'm thinking that'll already be filled in long before the 90-day review.
Yeah, Lori usually goes in and fills those out, I believe, Lori, correct, when they do move in, like when she receives a TFA request for them to move in.
Perfect, perfect. Okay, so on the update screen, pretty simple. If his income changes, you'll want to type the new income in here, $1,700. To make changes to his income, click the HUD verification link. It'll bring you back in. You can use the pencils to add an income type if he has suddenly gotten a new income type. You can use the pencils to open, for example, his earned income and show that he has gotten a raise or perhaps is working more hours and has more income. Anything like that. Pencils are your friend here, and you'll exit. The non-cash benefits, the health insurance, and the disabilities all look exactly like that. You'll click the HUD verification, and you'll use the pencils to make revisions. Any changes that have been captured, then you can save and exit, and you'll see that there is a review here. So if you have someone that has multiple reviews, that's fine. You wouldn't come in here and write over this one. You would just create a new one in what, February then, for another 90-day recert. No, March, whatever. So you'll do as many of those as you need to. There's no limit. It just creates a list here.
Okay.
When you are ready to exit someone from the program, the pencils in front of the exit dates will get you what you need. So you'll click the pencil in front of exit date. You want to make sure you choose everyone in the family because traditionally they all exit at the same time from a program like this. You'll type in your exit date. You'll choose a reason for leaving. And these are just generic. For housing opportunity. And this person moved into a rental with no ongoing housing subsidy. Save and continue. And of course, you are back on the assessment screen. It automatically chooses the exit assessment now. And the exit assessment is very similar to the update. It's asking you for any updates in their income, their non-cash benefits, their health insurance, and their disabilities. It's really just trying to track those things and how they've changed while they're in your program. Once you've filled in any changes here, you can save and exit, and you are complete. You are done. There is a place for case managers. I don't think you guys necessarily have to use it. It doesn't benefit you guys in any way.
Yeah, we won't be using that.
Yeah, you don't need to use this. It just shows you people that work for your agency, and you can type in the names of case managers. Now, Bill, I assume it's an SS, I think it must be an SSVF requirement to enter your service transactions.
Right.
So once you've completed up through this entry exit tab, so these are the ones you need to complete, you'll click up here on this service transactions tab. And there's a lot of buttons here, but really don't worry about them. The only one you really need is add service. You'll see that because this was a family, the whole family is listed here, and then Bill is identified as the primary client, the veteran in this case. And for the most part, I would say your services are going to be tied to the veteran. In the off chance they would be tied to the whole family or perhaps to an individual, you can make those selections here. Okay, so the service provider is, of course, you guys. You'll probably, now that you have two programs, you'll want to choose the program this person is in while they're receiving services. So I'm going to use the Rapid Rehousing Program. You will enter a start date, and then there's a place for end date whenever they are done receiving their service. There is an option in the system that I don't have check marked for you guys right now, but I can change it if you feel it would be appropriate, that will automatically populate the start date in the end date. So it would have said 9/27/2017 there as well. But I didn't think that that would be helpful in any way to you guys, so I left it out.
That is helpful.
It is helpful.
Yes.
I was thinking that services would carry on beyond one time, but I can change that. So yeah, it'll automatically populate in there. Start date always comes in as today's date. You can change those. You do not have to worry about the timestamp, same as when you do the entry exit. So service types. You have a drop down, and these are the service types that I pulled from the data manual from the current year. There was not a list provided in the 2017 standards that take effect on Sunday. So I'm assuming there have not been changes to that list. If you find a service that you provide that is not on this list, you can certainly let me know and I will add it to this list. And in the interim, so that you don't get hung up waiting for me to respond, you can also use the lookup button. The lookup button will take you into the entire AIRS taxonomy. You can search by code up here.
I think one that I didn't see on there was general housing stability.
Because it's not an AIRS taxonomy code.
Lori, what is that in Pennsylvania HMIS?
general housing stability.
What is that? Like, what do you provide with that? I don't understand.
Beds. We would put beds under that.
Beds, like you literally got somebody a bed to sleep on.
We purchase beds for every one of our clients, yes, and so that's what we would put that under that category, general housing stability.
Interesting. I think that must be material. I think that must be material goods for them.
Okay. Beds.
Or we could just make it beds.
That's funny.
What's it say here? General furniture provision.
Yeah.
You like general furniture provision better?
I mean, yeah. I mean, I don't know what that changes on our end. It's still, like on our TFA forms here, it says it's going under general housing stability, and then the case managers will list in parentheses beds, that we were getting beds. So I don't really care what it is in here as long as we all come to an agreement that that's what we're going to use. Lori,
so it records as general housing stability on your reporting.
And that's coming right from the VA program guide for SSVF.
I wonder if it's not an AIRS code, apparently. Yeah, it just doesn't come up at all. Okay, I will ask about it.
Okay, I mean, for now, we can just put it in as the material goods until we decide.
I'll put the question in today. They're usually pretty good about getting back to me within a couple of hours, so
okay.
I should have an answer for you.
Okay.
But because I don't, like Brian Miller
right.
at ECD does all of his own like categories into the SSVF report, but I don't do that. Bowman does that for me. So I'm wondering what other people that use Bowman are using for that general housing stability, because it wasn't listed anywhere.
Right.
In the data sheet. Does Bill do that?
No.
Okay, so that's why it's not on here then. Okay.
That's why, that's why he wouldn't have worried about it, because they don't typically do that.
Okay. I will ask today, and I will get you both an answer.
Okay. Thank you.
Sure. So once you choose your service, you will save and continue. And what that does is it like automatically enters the person in the service, and then it asks you for more information. So these are probably familiar too. It'll say the type of SSVF service. Are these familiar?
Huh.
So I'm going to say this is, you guys don't usually do this?
Yeah, Lori, I think so, right, Lori?
Yeah. I mean, I only put case management in and then
TFA.
All right, so you'll choose case management services, and then SSVF financial type is sort of a duplicative of the service type, and I'm not sure why they have it that way.
So look there, though. The General Housing Stability Assistance is right there, emergency supplies or other.
There you go.
So that's interesting.
You know what? Well, you know what it is? Service Point, unlike PAHMIS, operates on the AIRS taxonomy. These are AIRS taxonomy codes. But down here, this is where it's pulling for your report.
Right.
All right, so what do I do when I put management in? There's no end date for that until they get recertified, and there's no financial assistance for case management.
That's fine. So you won't put an end date. There's no need for an end date because that is an open service for that person. And for financial assistance type, you'll, I guess, leave it blank.
Okay, I didn't know if I could leave it blank. Okay.
Yeah, I think as long as you make sure you choose case management services as the type of SSVF service, you're fine, because it's not like you chose something that there's a direct payment.
So what if I'm paying rent, though? What do I put?
If you're paying rent, you will do.
So, but then would she go in and enter a different service? You know what I mean? So we would exit out of this one and save it, or does she go back into the same screen?
No, you have to enter each service individually.
Right.
So this person's getting case management and rental assistance. I will finish this by doing case management services for the type of SSVF. There's no financial assistance type because case management's not a financial assistance.
Exactly. Right.
There's no amount you have to type in here because it's not a money. You can save and exit.
Gotcha. Okay, that was my question.
And it will list a service provided here. There's no service end date because I left it open because case management isn't like a one and done.
Right.
And then,
now, when we close a client out of services, do we have to go back in there and revise the end date, or will it just select the end date as the same date the client is closing, which is obviously when the case management would end?
No, because in some programs, you can continue to receive services even if you've exited the housing program. So because of that, it will not populate an end date automatically for you. You must exit people out of services by going back into this screen and typing in the exit date.
Okay.
And then you'll have to exit them from the program as well.
Right.
And then if you have multiple services, so like that was case management. If I want to also add
financial assistance.
Yeah, like rent payment, for example. Save and continue. And then it asks me for this SSVF information.
So what am I putting there?
See, I don't know because I don't know the SSVF program. I would literally have to ask Bill. These are not categories I ever encounter. And there's very little information.
I think you would, I don't know. What would you put under HMIS, under PA-HMIS?
I don't have to go back in and do this. If I put and the stuff we're using now, if they're getting rent, I click that they're getting rent. I put the start date, the end date, which is the same day, and that's it. I don't have to go back down there and pick the type of service.
So I don't know, would we say that it's case?
I'll get you a resource that outlines every single one for you. Don't worry about it.
Okay.
Okay?
I don't know if we would go in and go back in and
know this stuff. This is not my my world. But you know, every program does it differently, and like I said, Brian has tied certain things to the reporting for SSVF because he has all that control, but I don't. So
Kelly, what does it say? What's it say? What are the drop-down box options up there at the top where it says provider-specific service above?
There's nothing there. Provider-specific service is literally something that your system administrator, aka me, types in. So I can type in general housing stability there, but it's never going to tie to your SSVF report. So I want to make sure you guys have the stuff that ties to the SSVF report, because otherwise it's useless.
Right. So we need something that says under type of SSVF service, we either just put the financial assistance under case management, or there needs to be a drop-down box for TFA, temporary financial assistance.
So if I choose, there's different ones. So outreach services is one, case management is one, assisted in obtaining VA benefits asks you what kind of VA benefits. Assistance obtaining or coordinating other public benefits asks you what kind of benefits. Direct provision of other public benefits has a whole list.
Huh.
And the last one is other, I don't even know what TFA stands for.
Temporary financial assistance. That's what we need. That's what we need. We need a drop-down box that says TFA.
That's what this is. Other non-TFA supportive services approved by the VA. So that's your rent, right?
No, that's saying other non. It's saying not TFA. It's saying other.
Sorry.
No, that's okay. We would need one that says temporary financial assistance, and then we would go in and put in what the financial assistance was and the amount.
Right. Except It won't work that way. We're going to have to work within the confines of service points. So what I need to provide you with is a document that will tell you what these categories correspond to. Because if I change something here, it will not tie to your report.
So that's why I'm wondering, do we just put it under case management services?
No. And like I said, I would want to ask Bill how he's done it, because he's had successful SSVF reports on the first try every time since he moved to this system. So he's doing it right. But that's why I said I'd want to ask him.
Right.
Because I don't know. I don't know how they determined they were going to do it. And I trained them so long ago, I can't remember. So I will find out for you, and I will provide you with information about this.
Sounds good.
There should just be a red thing here. It's dumb that there's not. Okay. So yeah, so you have to enter each service individually. So, you know, you have case management, you enter that. You have a rent payment, you enter that. You bought a bed, you have to enter that. You can't just like go through and check mark them. They have to be entered individually. Okay. All right. So that's entering services. And that completes entering a client for you guys. The client information tab over here will take you back into the client. If you need to go back. If you need to go back into their entry exit, you always have the option to use the pencils to go back in. This pencil will take you back into the entry information. Pencil will take you back into the exit information. If you need to go into the 90-day research, you can click here and use the pencil to go back in. So it is very different, and they just all are. That's just the nature of the beast. If you are interested in the reporting, you click on the Reports tab. At the very bottom, you'll see there is an SSVF 2016 export. There will be an SSVF 2017 export shortly because they are changing the format of the CSV file that is necessary for the upload. If you click on the SSVF report, you can run this at any time to do data quality checks if you want to. You will choose the appropriate program. You'll put in an operating date range. This date range can be anything you want to check. It doesn't really matter. It doesn't have to be a year, I guess is what I'm saying. You can run a quality report, which will provide you with some information, or you can export, which will provide you with the files you need for your upload. The quality report gives you this. It'll show you how many total records you have. It'll show you any that are missing. And the missing records are links. So if you click on them, it'll tell you the veteran or the client that's missing that record. So I can say, okay, this guy doesn't have a full social. He's number 8805. I'm going to go back to my client search screen. I'm going to cheat and use this client ID search number. He's 8805. I'll go in and I will revise his number.
That's cool.
So you can do that if you want to help with data. Again, I don't know if you guys are going to run your report out of here or what your plan is, but it's here if you want it.
Okay.
And it'll show you all the fields. So if you export it, of course, you click the export button, and once it's exporting right now, it shows up down here as a zip file. And I think this is pretty standard. You get a zip file from HMIS as well. And if you open the zip file, you'll see the CSV file. So that's it. The only thing I want to talk really quickly with you about before I let you go is the changes. So I'm not requiring my SSVF or my PATH providers to sit in on my data standards training. And the reason is that I have training with you guys today. I have training with Kimbra from YWCA in another week. So I'm just going to cover you guys individually, and I will cover PATH individually because it's just one agency. There's not much that affects you. The only thing that was veteran specific that affected you guys was the VAMC number changing from typing in to pick list. There were a bunch of other changes that impacted VASH, but that's not anything you guys have to worry about. The things that you'll see changing are the gender options. The gender options for trans female, trans male, and gender non-conforming are going to be new. As of Monday, you'll see those.
Kelly, before you continue, what were the changes that were made to VASH? Because we do serve VASH clients.
The changes that were made to VASH were, there's a new tracking element for VASH vouchers, but there's no VASH in my system because I don't have anybody that enters it.
Well, so we will be entering clients that have VASH.
Right, but you'll be entering them for SSVS, not for a VASH voucher.
Right. Okay. Okay. Gotcha.
So you won't have to do these.
Okay.
They were small. It was a different type of voucher option on a drop down. It was a different type of reason that you exited case management. And it was
so why would they have that? Are there actually VAs that provide HUD VASH vouchers that are entering data into HMIS into the COC's HMIS system?
You know, I would say there must be, but you also have to keep in mind that unlike necessarily PA-HMIS, where they have a lot of really direct local control, Service Point is 80% of the HMIS market in the nation. So when you're talking about there being HUD VASH assessments in HMIS, it means that somewhere in the nation, somebody is doing it.
Right. Okay.
The other thing you also have to keep in mind is, I don't know how prevalent it is, that Service Point has made those changes because they've been mandated to by HUD. So HUD is saying you need to have VASH assessments available in your system. But I don't know who is actually doing it.
Okay.
Okay. So that was a pretty minor change, but the language will change, just something to keep in mind. There's a little bit of language change when you're exiting a client under the destination. It's very minor. So they're going to be saying that the permanent housing that's not RRH for formerly homeless persons. So that's your permanent supportive housing, your SROs, things of that nature, which is in direct contrast to a rental by client with an RRH or equivalent subsidy. So when you guys exit people, you'll have to keep those in mind. The system right now doesn't identify an appropriate destination for people that are receiving an RRH subsidy. And then the other one we talked about when we went through it. The non-cash benefits, there will no longer be Section 8 or temporary rental assistance as options there. The disabilities page will change and you will only have to do those 2 questions. And that might be the big stuff for you guys. The other big change they're making is, and I don't know that it's so much of a change, but maybe that's just how we operate in York County. So when you do an entry date, so when you're doing the first screen for entering a person in a program, traditionally the entry date was the date that the person was like accepted into the program. They might not actually be in housing yet, but they were accepted into the program and you were actively working towards, you know, housing for them. The change they're making here is that for permanent housing, for permanent supportive housing, and for rapid rehousing, this date needs to be the day the person was admitted to the project. And HUD has changed what admitted means a little bit. So admitted is that information from the consumer or the referral source indicates that the person meets the criteria for the program, that the consumer wants to be housed by your program, and that the client's able to access services and housing in a reasonably short amount of time. So that's for communities that were keeping people on wait lists. They're saying don't do that anymore. The odd thing about this, and probably the biggest change for everybody, is that the admittance date is no longer the date at which you had already, you know, gathered all the paperwork to verify homeless status and all of those things. HUD is now saying that the admittance date is the date that you think the client is eligible for your program, and you start the process of getting all of the documentation in place in order to serve them. So if somebody comes to you, or somebody comes to outreach on Wednesday and says, you know, I've got a serious mental health disorder and I've been on the streets for over a year or whatever, and you start, you know, working through the process with them, when you start working through the process, that's the admittance date. It's not once you have all the proof of the severe mental health or the proof that he's been homeless for a year. So that might be a little confusing to people. And then, of course, your residential move-in date is now your housing move-in date, and that is very simply the day the person moves into their apartment or their house or their room or whatever the situation is. So that's what's changing. But I will get you, I'll email you the release of information for York County. I will find out about the housing stability, general housing stability category, and what we should put under the heirs taxonomy, because it's listed under the SSVF services. And then I will get you a little bit better definition of those SSVF types of service, so that you know exactly which one to choose when you are going through here, these things.
Okay.
So I will get as much of that as I can to you today. The only one I'll have to wait on is the response for housing stability and the type of SSVF service. I'm going to look and see if there's a document service point for that.
Okay.
You know, like anything, the easiest way to learn it is to do it. Lori, I am here for you whenever you need me. Call me, or I tell everyone I'm much better by email, especially since I have 2 kids now, and inevitably they are always sick at opposite times. So if I get an email from you and I'm home with a sick kid, I will still call you back, or I will email you back with an answer, but I tend to not be very good at calling in to check my voicemail. So it's better to email me. But if you start working through it, you have trouble, let me know. We can always jump back on this system, and I can actually give you control, and then I can see your screen and how you're doing it, and we can talk about it.
All right.
Okay?
Okay.
All right, ladies, keep in touch and let me know what you need. I will get this stuff to you as soon as I hear back with answers.
All right. Thank you very much, Kelly.
You're
right,
welcome. Take care, ladies.
See you. You too.